Okay, good day. Now we'll go to the ethics of online research. For those of you looking on doing internet-based or online research. So at the end of this lecture, you should be able to discuss the ethical guidelines for the conduct of internet-based research and understand the different issues regarding internet-based research or IBR. So what exactly is internet-based research? So this is basically any study or research that involves online surveys, web page content analysis, video conferencing, for example, for online focus groups or interviews, analysis of e-conversations, emails, any study involving chat rooms, discussion boards, and or blogs. Okay, so these are further classified as observational, interactive, or surveys or interviews. So the definitions of each are that observational research includes collection of public information. So this basically involves studies where the participants are not aware of the research. In interactive research, however, this is where researchers contact participants for permission to view their content. So here there is sort of a partnership between the researcher and the participants. So the participants are aware of their participation. Okay? And lastly, surveys or interviews are methods where research employs mailed surveys or consent forms to accomplish data collection. So this is where you do your surveys and send them via email. Okay. Now, there are several questions for making online research, okay? Specifically the ethical aspect of doing such internet-based researches or online researches. First is, of course, is there only minimal risk of harm specifically for the participants? Okay, so when doing internet-based research, you still have to look at the risks that your participants are incurring. Okay, so another important aspect is the integrity and the autonomy of your research subjects. Are they adequately secured given that you're not face-to-face with them? Are your methods adequate for your particular design? And is the knowledge produced relevant enough? So you should always think about whether or not the actual research is relevant. Okay? Now, in 2017, and according to the National Ethical Guidelines for Health and Health-Related Research, research in the internet shall be limited to those that entail minimal risk. Okay? And that the data collection should be justified. Okay? So basically what they're saying is you don't just do internet-based research for the heck of it. Okay, so there should be adequate justification as to why this is your mode of research. Particularly because there are potential sources of harm in such research, such as when questions asked provoke emotional reactions. So when you do your surveys, are your questions actually invoking severe emotional reactions that may potentially be of harm to your participants? Okay, so in instances also where the welfare of an online group or chat room is damaged, or in worst case scenarios, a breach of confidentiality. As we all know, hackers exist. Okay, they can uh, hack into your research very easily, especially if it's internet-based. Okay, so what are the risks in internet-based research given that you're basically interacting with them digitally? So in social sciences, they found that psychological and physical harm to participants may be caused. For example, the research evokes bad memories or reduces a person's sense of pride or dignity. Okay? Or by cases where the anonymity of the participant is not maintained as originally agreed. For example, there's a data breach, your data is hacked, okay, or accidentally posted online. So those could be potential risks for your participants. Other examples would include cases wherein, for example, an LGBTQ was accidentally outed by your research. Okay, so what are the potential harm for your subjects. Of course, emotionally, psychologically, or in instances where certain aspects of their data may cause them to lose employment or to affect their relationships with other people. Okay, so how do you determine risk when you're doing internet-based research? It's actually more difficult because um, fewer studies have been conducted that researchers can learn from. So not a lot of people are doing internet-based research still. So there's not a lot of material to learn from. Also, since you're interacting digitally, it's harder to judge individuals' reaction to research, no? So you don't know if they're getting stressed, they're getting angry or depressed by your questions or your research. So despite this, several authors have shared strategies to possibly address the risks by participants in internet-based research. So one is, of course, as with most researches or interactions with participants or patients, is that you have to build a good rapport with them. So this is key. So if you have a good rapport with your participants, you're able to disclose to you if they are feeling depressed or they don't feel secure with your research. Okay. Second, you establish an etiquette. Okay, so you establish certain rules, especially for researches that involve group discussions um, or groups of patients that you deal with at certain points of time. And then lastly, you always provide participants with an easy way to lead the study. So this actually is essential even with non-internet based researches. You always have to provide this sense of security for the participants in a way that if they decide to not participate, they're able to do so. Okay, so one of the very critical aspects of internet-based research is the concept of confidentiality. Okay, so any misuse of data storage or the use of or misuse of data actually can cause harm by specifically by violating the confidentiality. Okay, so take note though, for qualitative studies, it is relatively easy to identify the source of a verbatim quote using search engines. Okay, so they just type it into Google. They might, for example, you posted something on Twitter years back, you forgot about it. What you didn't know, it's still searchable. Okay. So in internet-based research, so sometimes you use email to send surveys, interviews, or you basically correspond with your patients or your participants. Okay. Please take note though that email addresses are often identifiable, especially if they contain names or other details of your patient. So by itself, you are actually invading the privacy and confidentiality of your patients. So email should be reduced to a minimum, okay, with offline methods or alternative web-based methods. Okay, so what you can do, you can set up a discussion thread or basically any method that will help protect the identity of your patient or your participant. Now, let's talk about online repositories. So, are they really safe? So, when using repositories such as Google, AOL, Yahoo, etc., you always have to ask yourself, what measures safeguard the data at the site of collection? How long will the data be stored? What happens to the data once your research is done? How is it destroyed? Is it destroyed? How are images and audio effectively anonymized? So these are valid questions. Okay? And take note, especially because here, if you look at the terms of service for cloud storage, for example, for Google, basically it says they can use your content. Okay? Same with Apple. Okay? And On top of that, they do not represent or guarantee that the service is free from hacking, security intrusions, etc. So these are some points to consider when you're doing internet-based research, especially since uh, even recently these were articles posted in 2021, no, wherein the iCloud terms and conditions may be illegal. And I think you may have heard of this when Facebook's data was leaked online. Okay. So aside from using those particular services, what about email, Viber, Messenger, and other web-based conversations? Similar concerns. So basically, is the data easily searchable or retrievable? Is the communication archived or easily searchable? How long is the data stored? How do the terms of service articulate privacy of content? And how is the content shared with third parties, if ever? Okay, so in LinkedIn, Google+, Facebook, Twitter, Tumblr, questions are also quite similar. So how is it shared? So is your privacy? So what are some strategies to reduce online breach? Okay, so you can do either secure transmission of your data or adequate data storage. So in securely transmitting your data, you use encryption. You use data labels that only you can decode, and you always have to try to separately transmit personal data and experimental data so that if the transmission is compromised in any way, at least the data are separate and they cannot be used. Okay, if you're not transmitting your data, you should be adequately or securely storing your data. So it needs to be password protected. You have to separately encrypt the personal data and experimental data so that no one else can read them, or you code the data so only you can read or decipher them. Okay, so same principle applies to internet-based research in that you have to get informed consent. Okay, so the data privacy law dictates that it is required, especially for internet-based research involving human subjects. Participants, uh, same as with face-to-face research or live research, they should always have the option to ask anything they wish, and they should understand that their participation is voluntary and that they can withdraw at any time. Okay? So participants should also be able to ask questions about the informed consent itself. Now, there are still issues with regards to this. So, especially because you're using the internet, you're doing this digitally. So, what procedure should you be following to obtain consent? Okay. So, do you give virtual consent tokens? Do you use click boxes or waiver of documented consent? Especially because, as we've learned previously, informed consent should be documented, written, signed, and dated. So how do you do this when it's in the internet? And how will the researcher ensure that the participants are truly informed? And what medium do you use for informed consent? Do you use the email? Use Google Forms? Do you use Zoom? Okay. So how do you assess informed consent when it comes to internet-based research? So as compared to face-to-face context, no, where it is potentially easier to ensure that the participant is fully informed because you can see them reacting or nodding or agreeing with you. Okay. What you can do is you have to apply techniques wherein you increase the readability of your document. So, especially since you can't be there while they're reading the consent or filling up the form, you have to ensure that the document is readily understood by your participant. So, you reduce the text, you use different colors, you use subheadings, you change the font sizes, etc. You can do that. Another method you can use, you can do like a post test to check the understanding of their participant. Okay, so this could be although this could be an extra burden to you and the participant, okay, especially if your consent form is so long. Okay, okay. So when you do your informed consent, you also have to check your participant. Are they able to give you informed consent? Now, for internet-based research, it's very difficult to verify. Okay, so you don't know whether the participant has actually read the details carefully because you cannot see them. Okay, so you cannot easily access them to check whether there are any misunderstandings. Okay, and you also have difficulty in verifying certain information about your participants, such as age or mental capacity, because you cannot actually see them. Other issues are, of course, when you're dealing with minors and parental consent. So how are you able to go about doing this when it's an internet-based research? And how do you effectively screen based on inclusion and exclusion criteria when you cannot see your participants? Okay. Some questions that need to be answered, especially when dealing with minors. Okay. So how do you identify them as minors if you do not ask for demographic data? Okay. If you ask for demographic data, what harm could there be to the participant if you know their age? Okay, how will parental or guardian consent be obtained in addition to assent where it is required by research regulations? And what risks might arise in this particular consent process? So you should consider your process, whether there are any risks. So to help you, I know you're getting overwhelmed by all these questions about internet-based research and you're getting kind of discouraged. There are actually some codes of conduct that you can follow that may help or that may allow you to conduct your research through the internet if needed. Okay, so first, you should always ensure that the participation of your participants should be voluntary. Okay, so you put that in your consent form. Okay, you should also ensure that their anonymity is maintained. Okay, so when you're getting personal information, they should be sought uh, with the respondents knowing that they are giving their personal information. So you should put there a statement that you will be collecting this and that when you are collecting this personal information, you would ensure their confidentiality is not breached. Okay, and you should inform them of all the aspects of your research, particularly the duration of the survey. And you should be given links to data protection, privacy policy, cookie policy statements, or information about the software that you're going to use, which should all be available in understandable or easy to access language. Okay, so no highfalutin terms. Okay. Now, if you're going to use a survey wherein there are certain software that they should install, you have to make sure that these are installed with the respondent's compute or with the respondent's consent. Okay, and that this can be easily removed from their computer. Okay, so if ever you have to give them instructions. Okay, so respondents should also be given entitlement to ask the researcher to delete the records. So they have a right to ask you to delete the records if, for example, they want to withdraw. Okay, and you should always consider that you will only conform to their request when it is reasonable. They cannot just ask you to delete their data out of the blue. You have to ask them what their reason is if they're going to withdraw in particular. Now, their reasons for withdrawal are not necessary. Okay, you just ask them why they want their records deleted. Next, in the case of surveys where an email list is acquired, for example, you want to do an internet-based research on your classmates and you ask the UERM email addresses from the IT department of UERM. Okay, so this is possible. This can be allowed provided that in your consent form, you state that you obtained it from that in that manner. Okay, and make sure that the individuals listed have consented before to be contacted in future for any research purposes. So they have to have had prior consent. Okay, so in order to ensure confidentiality and privacy, these are some guidelines or tips or strategies in order for you to protect the data of your respondents. So encryption, okay. If your data is stored on a server, you have to take necessary precautions to prevent unauthorized access. So use passwords, etc. Okay. If you're going to use cookies or other log files, you should inform your respondents so that they can disable the use of cookies, okay, by using their own system settings. Okay. Researchers must observe all relevant laws and national codes. Okay. So you have to ensure that you follow the local regulations on data research. Okay. So you have to ensure also that the emails of your respondents are not revealed in any way, especially to those who are not involved in research. And in the case of any breach to data safety or anonymity, you have to assure your participants that they will be informed immediately so that adequate steps can be taken. Okay. Now, as with all researches, there are certain ethical principles specifically for internet-based research. So there's firstly, you ensure transparency while recruitment. So you have to give all the necessary information for the respondents prior to their enrollment in your study. Okay. You consider the participants' expectations, perceptions, and awareness about their privacy. So while you're getting their consent, you have to manage your expectations. You have to address any concerns they may have about their privacy. And again, you have to ensure compliance to national data protection laws and other ethical codes. Okay. It is advisable also to use a password identity system to ensure authentic participants. Okay. Ensure that consent is informed and knowledgeable, and that the privacy statement is provided, which mentions the purposes for which the data will be used and the strategies for maintaining confidentiality and privacy. It is also advisable to assign participants a unique identification number to track progress and maintain security. So once you enroll them, you assign them a subject number so that this will also be another layer of protection of their data so that it will not be traced directly to them. Okay. And provide opportunities for participants to reach the research team for any concerns or questions. Okay. And as mentioned earlier, always honor your participants' request to delete their records, but within reason. Okay. Again, you should try to get your data encrypted. You use password protection for all your computers, specifically those used to gather data or store data, and remove all identifiers before data analysis. Now, this holds true for other research as well, so that there would be no unnecessary bias. Okay. Okay, so next, you should ensure no unauthorized person is able to access your data and ensure that data are not used for subsequent non-research purposes unless you have gained consent for this. Okay. Now, the National Ethical Guidelines for Health and Health-Related Research also included some guidelines for internet-based research. So for those who want to do internet-based research, you should check out the following guidelines. Okay, so first, the following questions should be answered to ensure that respondents' right to privacy and confidentiality is upheld. So how are your participants recruited? How can you fulfill the requirements for informed consent? How will you ensure anonymity? of your subjects? Is the online behavior public? Or do respondents have reasonable expectations of privacy? Do the individuals know or expect that records are being kept? Okay. So, if in your respondents have reasonable expectations of privacy and impermanence, researchers may need to take specific measures to inform the respondents and obtain their consent to use their data for research. Now, soliciting participation of minors should be done with extreme care. So, unless it's really intended for pediatric patients, be careful when dealing with minors, okay? Or try to avoid this. So research in the internet shall be limited to those that entail minimal risk. So you have to evaluate the risks of your research. And you provide additional safeguards for maintaining privacy and confidentiality. It is also advisable, though, that your study team includes someone who is familiar with technical issues. So an IT or a techie person on your team would be encouraged or highly appreciated. Okay. Okay, so that concludes our discussion on internet-based research. These are the resources for this particular lecture. With special acknowledgement again to Dr. Wangko's lecture on internet-based research. Thank you for your kind attention. Okay, you may proceed to the next lectures, and take note though, most of the questions for this exam will be obtained from the lecture. Right? So no need to read all the ethical guidelines. Thank you very much.